All right, welcome back. Alongside Jay Sparks, I'm George Young, and it is time now for our Missouri Orthopedic Institute segment. We backed off on this just a little bit. We hit it once a week during the football season because they had a clinic going on Saturday morning, so the football season is done, and so isn't the clinic. But with us now, Dr. Skelley, and welcome aboard, or welcome back. How you doing?
Oh, doing great. Great to see you guys.
Good to see you as well. Thanks for sneaking in. So anybody gather you up at the front?
No,
okay, all right.
That's how it works.
Wow, that is kind of how it works around here. But we appreciate you taking the time. I know we'd gone back and forth, not you and I, but myself and Eric had gone back and forth about different topics that we cover. And I wanted to get going with the multi-sport athlete because we've seen a lot of it. I've seen a lot of stuff coming out in the last year or so. The Aspen Institute had a study that they put out talking about, multi-sport athlete is far better than the focused athlete. In your experience, why is being a multi-sport athlete better than hyper-focus on one?
Athletes that specialize in just one sport are more prone to have overuse injuries. But there are some sports, gymnastics is one that comes to mind, tennis as well, some soccer programs, where having an athlete become successful in that individual sport is very important for getting the competitive teams or getting the select coaches or if you believe in the 10,000 hours rule, having that experience to become very proficient in the sport. So I do meet a lot of athletes in my clinic who have that focus. We try to encourage diversity and focusing on multiple sports in the very young athletes and teenagers as well. But in today's sports climate, that's becoming more difficult. Most people want to focus on one sport.
Do you go through when they want to focus on one sport and you come across one of those repetitive motion injuries, do you counsel the athlete and the parent of, okay, you got to back off on this a little bit, or maybe it's time to switch a little things off?
Absolutely. So the sports where I see that most often would be baseball, tennis, and swimming. That overhead motion with the shoulders is very, very difficult for young athletes. And so those are the ones where we see it most often. But yeah, it's something that we have to watch out for, and that's why we encourage multi-sport training in the really young athletes, the adolescents and pediatric patients.
Is there a sneaky, I'm not going to say dangerous like F1 racing, but is there a sneaky high school sport out there that catches up to kids? I'm thinking in my brain, wondering about like golf, because you see a lot of golfers, they kind of have mysterious injuries. They have an injury and it never really kind of heals up. It never really goes away. Is that something where are there any sneaky dangerous sports that you notice?
Not necessarily a sport, but it's more just that overuse idea. It's when you're doing a repetitive motion. So whether that's a golf swing or a baseball pitch or a swimming stroke, it's those repetitive motions that the body is not used to seeing. And when young athletes are doing that, it can cause changes in the anatomy and make them prone to injuries. And so it's I wouldn't say it's one sport. It's more the act. That's what I'm watching for.
Okay. And with those injuries, you talk about rehab. Just walk us through this a little bit. We tell people how important rehab is. As a former athlete, I was used to going through that every now and when you get hurt. But even now, how important is that rehab?
So rehab is extremely important. So as an orthopedic surgeon, I tell my patients that my surgery is just one point in time. It's really the rehabilitation and the recovery after the surgery that makes equally, if not more, of an impact on the injury and the treatment. Depending on the type of surgery we're doing or the type of injury they have, whether it's an overuse injury like we were talking about or a surgical procedure, rehab is very patient-specific and very injury-specific. And so having a good physical therapist or athletic trainer that you're working with to rehab an injury is crucial to a good outcome and getting an athlete back in the game.
How important is a second opinion?
I think the second opinion is very important, especially for athletes. It's something that I encourage my patients to seek, and I frequently get referrals from other specialists in the area as well. In sports orthopedics, we're taking individuals that are very, very healthy and at a very high level of functioning. They have a temporary setback with an overuse injury or a specific traumatic injury. And to get them from 100% back to that 100%, is a very narrow margin. Right. And so it's understandable that if you're considering something as serious as a surgical procedure, to get other opinions. It's something I encourage, and if I've had injuries myself, and I've done the same. And so I think getting a second opinion is important. important. And for those athletes that want it, something they should get.
Dr. Skelley with us, Missouri Orthopedic Institute. In part of the topic today, multi-sport athletes rehab, we just covered through. And I mean, the near and dear to every surgeon's heart is the ability to perform the surgery. But that's not necessarily always the case. And people have that misperception that if I'm going to go see a surgeon, automatically underneath the knife. For you, is there a marker of this is something that you can play through and we'll address it at the end of the year, or this is something that, nope, sorry, shut it down. We got to take care of it right now.
So that's my every day. Every day I'm encountering that question. And that's what we as medical team providers, when we're standing on the sidelines or we're covering a sporting event, that's what we're asking ourselves in each injury that we see. Is this something we need to pull the athlete out for? Is it something that's going to need surgery? In my practice, I try to use surgery as a last resort. So we maximize all other treatment modalities that we have to do non-operative treatments, but when an injury necessitates surgery, then I'm there to help the athlete with that.
If you didn't know, if you weren't supervising rehab, if you didn't know, when an athlete comes back in for a checkup, do you know whether they've been doing their rehab?
Absolutely. Sometimes I can tell just by the limp as they walk into clinic. So, yes, there are a lot of indicators of how important
Mayhap, how's the whale hunting going?
One of the benefits of taking care of athletes, and also in our area in Central Missouri, we get a lot of military personnel as well. It's definitely one of the benefits of kind of my medical specialty focus, and that most of our patients are very motivated to participate in the rehabilitation process and are energized about getting back into the game, which is very nice.
Dr. Skelley with us here. As we get ready to wrap this up, I know this is that transition phase. Guys are getting done, and the ladies are done with some of their fall sports, as it were, getting into the winter sports, the basketball. What are some of the things that you have to watch out for making that transition from maybe the fall sports into basketball? Because now all of a sudden it seems like it's a totally different range of motion.
You're absolutely right. With that transition to a new sport, it's conditioning yourself, getting used to moving in a different way or performing different activities that can set athletes up for injuries. Also equipment, making sure that the shoes, the equipment that they're using is appropriate for the new sport is another thing that can set them up for injuries. And so there's definitely a transition period this time of year that athletes, coaches, and trainers need to be aware of.
Do you see more injuries during that transition as opposed to...
It was actually interesting that you said we used to have the Saturday morning sports clinic during the football season. It was extremely successful. We were very happy to put that on. And going forward, though, this is such a busy time. We've actually been debating trying to continue that or bring it back to the community because it was so successful. Yes, this is a very busy time at the end of the year for us, not just because of that transition in athletics, but just students as well with the winter break. We're currently trying to cancel clinics to add on more time to take care of people and add on additional clinics actually for the athletes. So the end of the year is a very, very busy time for us in this transition between sports and academic schedules for students.
All right. Well, I know it is indeed a busy time. I know we see that here. We've got basketball tonight. We got basketball tomorrow night. We had it Tuesday night, and you roll right on through. You're still doing football and all the rest of that. So I know you've been busy, but I really appreciate you taking the time out today. Again, folks, if you missed this or you're tuning in at the very tail end of it, going, what the heck were they talking about? It is Dr. Skelley with the Missouri Orthopedic Institute, and the podcast will go up about 6:30 or so over on the SoundCloud, and you can just find it on KFRU.com or KLIK1240.com. Today's topics for multi-sport athletes, rehab, and surgery versus getting that rehab taken care of, and then making the evaluation later on. Dr. Skelley, thank you for the time. I really appreciate it. I know we normally go a little bit longer, but I've got a wrestling coach waiting in the rings, and I know if I don't get to him, he's going to pin me, and it's not going to be very comfortable. I'll be seeing you. So
understandable.
All right.
Thank you very much.
Thank you much. I appreciate it. That is Dr. Skelley with the Missouri Orthopedic Institute. We'll be right back. We've got more of the close, and that will include the head coach of the Missouri Tiger Wrestling Program, Ryan Smith, and he's got injury news as well.
The Closers on News Talk 1240 KLIK and News Talk 1400 KFRU.